Everybody wants this great aesthetics zirconia implant, but not everybody. Nowadays, a lot of people is a little shortcut. They created just kind of a mediocre, the full mouth zirconia implantology. So this video, is kind of a quick, and I would like to show them what's the difference what we made it, and compared to what other dental laboratory made it. Sometimes I got the top situation is different, the jaw, and some reason doctor have to put the different implants here and there. They're trying to secure here and there, which is clinical size. I cannot talk about that. But this case, I do have a problem, and especially these areas are sticking out facially. So same as usual, what I did compared to my previous video with all different cases, and we contact the doctors, we show them the design, what it look like, which is of course they don't like these sticking out the tools here and there. Who's going to like that, right? Hole and patching it, not recommended. So this full mouth implant, we just slip it, okay, and then make the aesthetic as possible. It's lower, and then also lower teeth has the implant kind of a print, let's say. So we make kind of a little indentation to lower as well, and then we finish the final restorations. It's beautiful aesthetics compared to any other dental lab, and we try to present it as world-class restorations to better than anybody. That's why I can show them as our restorations, not only design, and they communicate with the doctors and patients, which they already made the prototypes, and then we put it into the more design size tools, and then more minimized, make more individual looking. And also we put the layers, very minimum tiny bit layer, which is technique. All right, so I did not put the mono this case. Monolithic has a little limited, and this one natural lifelike restoration from the micro layering 3/10, 4/10 millimeter, which is our technique. Then we create it as maximum as possible to aesthetics. Some of the people, they email me and then they contact us. They really wanted a good lifelike restoration, kind of a thin restoration. The good narrow teeth, whenever they smile, big smile, they're poorly looking smile, right? It's not look like chiclet, not look like piano tooth, not look like man made it. So we made a great characteristic here and the embrasure, everything. That's what I would like to share today. I hope this case has more educate to you for your future cases, and then you contact your dentist, and that dentist can utilize it, some of the great laboratory to work, or they can contact us from their RX prescription, so we can explain what we did here. Our price is, everybody asking, price is the zirconia restorations. Price about $5,200 per arch. But whenever they make verified model, prototypes, we give them $2,000 off. So which is great deals. This is $3,200. That's it. Okay, one arch. That's all I can tell you, because a lot of people asking, what's your fee? What is this? So narrow down, so we make the top and bottom the restoration. All right, this one is what I'm talking. Individual looking, and a great embrasure, has some tint of the different color. That's why they can buy the high-end prosthetics as much as possible. The laboratory, that's the differentiations. You see this porcelain buildup and the micro layer in between the teeth, and to get the maximum intercuspitations. That's why we can offer to the patients proudly. This is what I'm talking about before I screw in, and then we finish the beautiful restorations, top and bottom. Here is the access hole. We just slip it 7, 11 area, and then even though implant down there, so we slip it. But it's a hole, we finished with the Thai base with the cement. It was a really hard time to put it in the passive fit, and then our technician had a lot of hard time trying to get the correct one. Anyway, you see the bottom one is 8 implant. However, the top only 6 holes. Okay, so that's why we fabricated the final restorations. Like I mentioned, here is the individual looking. Alright, the embrasure tissue. That's why you get the graduation is between the color, the tone. And this is the final, so that's why we delivered to the doctor's office.